Hello, my name is Dr. ASHOK VARKEY. I'm a pediatric consultant and gastroenterologist working here at St. Joseph's Hospital, Manjummel. I would like to talk to you about breastfeeding. So I would like to educate you about the importance and the benefits of breastfeeding. When a baby is born, the moment you give the baby the first feed, the moment the baby latches to the mother's breast, there is a bond which is formed. And that bond is very important because it helps the baby to relate to the mother and the mother to relate to the baby, and that continues throughout life. Other than that, the baby as a person has very low immunity at birth. In fact, almost zero immunity. So the breastfeeding, which is given to the child, which is given to the baby rather, it gives a lot of immune components which are transmitted through the milk to the child, and that continues through the first 6 months of life. Once the first set of vaccinations are given to the baby, then the baby starts getting a lot of immunity, and as he is exposed to the environment and other factors, he also develops substantial amount of immunity. So the breastfeeding, the importance is like the mother's breast milk has all the components that is required for the baby to grow optimally, and provided the breast milk is in sufficient quantity, that you don't need any other substitute for the first 6 months of life, and even later up to 1 year of life, it continues to give a lot of immunity to the baby. The other thing is that what we have found is that babies who have been given breast milk exclusively, they tend to have very low percentage of infections, in particular chest infections, respiratory infections, and also they seem to have less tendency to develop bronchial asthma later on in life. So I would highly recommend breastfeeding, especially exclusive breastfeeding for the first 6 months of life and continue up to 1 year onwards. Thank you.